Hey, Don the psychologist, a retired psychologist here again. My previous video deals with some general ideas about therapy, establishing a relationship with a therapist, and the therapist establishing a relationship with you. A few precautions about therapy, a little bit about types of therapy. I gave precautions about pastoral therapy. Being that making judgments about a person's psychological behavior, emotional condition, and often these psychological issues are not just psychological, they're medical, a lot of medical components. And unless the pastor, counselor, priest, parishioner, the reverend, unless they're fully trained in psychology and or psychiatry, they are very limited, and there may be some religious rules and answers to some simple questions that a person has. Otherwise, I say avoid pastoral counseling, and I think most pastors, priests, counselors in that field of religion should own up to that issue. Stay away from it. Give a religious advice. Talk about sin and sorrow, repenting, but people that come into a counselor's office are often heavily burdened with psychological, mental, medical, family, social issues. Okay, here we're going to deal with something, a precaution, a major precaution if choosing a counselor. And I'm dealing specifically now with young men and women, and I'm talking about people who are of a sexually active age, which could be somebody 75 or 80 years old, but mostly middle-aged people. Some are married, some are single. And by the way, the counselor, male or female, may be married, single, divorced, widowed, carrying on, maybe a guy who's a woman's man or a lady who is freewheeling. The point is this. There's an issue in psychotherapy at the very basics called the transference and countertransference. Transference is when a therapist, for example, becomes close to their patient and actually takes them into their life as something more than just a patient. There's not an arm's length anymore. There may be a personal, emotional caring. They may have heartfelt concerns. That's not so bad. And for a patient, and it's very often a patient, maybe a woman who is in a marital difficulty and has a young, perhaps a counselor, male counselor, their same age, and this female patient may become inappropriately attached to that counselor and continue counseling. Maybe some problems being resolved, but continuing counseling because the session becomes like a date session. I'm going to wrap this up very simple because you won't hear this anywhere else. If you're a female seeking counseling and you're heterosexual, seek a female counselor who is heterosexual. So it eliminates the possibility that you're going to have some kind of a love affair, a romance. And likewise for a young man. Seek, if you're a heterosexual young man, seek out a male counselor who is heterosexual, and maybe should even tell you they're heterosexual, and get that off the table. Because a young man can easily fall in love with, or fall in romance with, or fall in lust with the female counselor, and may make some passionate moves in that regard, and the female counselor may respond. And likewise with a female going to a male counselor, might start seeing this person really as a date, as a relief in life, as a source of caring, and may make some suggestions, or the counselor may make some suggestions or some moves or some flirting, and there goes counseling, and now you have a love affair. If that's what you went for, fine. I can tell you this. A counselor who does that, I can't think of any licensed counseling where if a counselor does that, and begins to have a romantic relationship with a patient, they are violating the law. And you can go down the rules, you can go down through check the list of what's happening in these licensing agencies, and these counselors very often, if they're in what's called a dual relationship, that is, they have a counseling relationship and a love affair, they lose their license, often just asked to surrender their license. And frankly, maybe some get away with it and get away with it just fine. But frankly, some counselors, let's just take a male counselor, and I can think of a couple of examples. The crap hits the fan when the relationship breaks up, and the patient says, hey, this guy, or the female patient, hey, this lady came on to me and used the relationship and abused me. They're open to lawsuits. They're open to losing their license. They're open to having if they're in a marriage, having that marriage breakup. That's my precaution. Now, if I mentioned heterosexuality, and the issue would be also, maybe if somebody's homosexual, then they should choose somebody who is heterosexual, so there won't be a chance of a relationship going on. Those cases maybe represent a risk in 25, I would estimate, these numbers come off the top of my head, 25 to 30% of counseling relationships will have that risk of transference and counter-transference. That is, where the relationship is no longer patient-therapist, but it becomes father-son, boyfriend-girlfriend, whatever. Next, I'm going to talk about another precaution in psychotherapy if you're seeking therapy, things you just ought to run away from. It was Sigmund Freud who developed Freudian theories of development, and then a theory and practice of Freudian psychoanalysis, psychotherapy. Some of the things involved in his development of personality included id-ego, superego, Oedipus complex, Electra complex. Much of that stuff is disregarded these days. It's still being studied some places. It has its place in history. I'll just give you an example. The Oedipus complex, I think people summarize it. Maybe this is wrong. But a boy wants to kill his father so he can have sex with his mother. That's the theory. And the theory is, according to Freud, that little boys go through that. There's a comparable Electra complex that applies certain sentiments about young girls. Forget it. All right, enough about Freudian development. Read about development. There's some good ideas there, some bad ideas, some silly things. The other thing is that Freud developed was psychotherapy, his form of psychotherapy, which included heavy emphasis on the analysis of childhood, upbringing, relationship with parents. It also involves the analysis of dreams. So I'm going to make out 2 points here quickly. If you go to a therapist because you've had trouble with all of your childhood and you're so upset and disturbed about it, it's been bothering you for years about what dad did or what mom did or what went on in the household and you can't get over it, then go get a counselor to talk about those events, maybe rehash those events, go over those events. Otherwise, don't go to a counselor trying to do that, because you will find, unfortunately, there are counselors, you'll go into their office, you'll go into the office with some problem, you're dealing with a boss, or you're dealing with an aging parent, or you're dealing with a relative or a neighbor, or you're dealing with your own depression and anxiety or poor feelings of self-worth. And a therapist, and they're still around, say, well, let's go talk about the household you grew up in. That's okay. Know a little bit about the household you grew up in. But some therapists want to go there and they want to stay there. And there are 2 reasons. They really believe it's going to be helpful to just rehash your childhood in spite of what in the heck is going on in your world right now, which is probably really what's troubling you. And the other thing is, this sets up therapy on an ongoing basis. In other words, the therapist has already set up, here's the plan, we're going to talk about your childhood, which, by the way, could take months or years. You've heard of counselors, you've heard of patients in being entertainers, movie actresses and actors who have been in therapy for 20 years. That's fine. It's a luxury. It's a luxury to be able to sit down and talk with somebody an hour or two twice a week at $150 an hour or whatever it is. That could be luxurious type of counseling, but when dealing with a specific type of problem, find somebody who wants to deal with what's going on in your life now. How did this come about? And how do we go about solving it? One more thing on this session here, and that is dream analysis, because part of Freudian psychoanalysis was dream interpretation. And typically, and this typically was when the Freudian type approach, and dream analysis can be part of any therapy. It wouldn't be bad if you went in and say, I had a dream last night about such and such. The point is this, that dream analysis, historically in the Freudian realm, the analysis was done by the therapist. You might come in and talk about, well, you were out playing the other day and you had a baseball bat and you hit the ball or whatever, and it might be, there were a lot of phallic references and sexual references in dream interpretation. And it may be that dreams are heavily loaded with hidden type of sexual symbols, but that's not for the therapist to interpret. If you came in and said, I was hitting the baseball and I hit it out to right field and it was my brother who tripped and fell, then the next question from the therapist, and there shouldn't be an answer from the therapist, but a question, well, tell me, what does the baseball bat represent to you? And what did it mean that your brother was out there in right field? Isn't he 8 years older than you? And why did he fall? That would be an example of dream interpretation should be done by the dreamer. And the therapist in that role should be urging the patient to interpret their dream. It can be helpful. I would doubt that session after session after session should be dealing with dream analysis. But as advice, even for people not in therapy, if you're dreaming at night, it's best if you have sleep with dreams. And you wake up during a dream or wake up in the morning, it might be a good idea to write your dreams down. Write them down. What did this mean? Because I've been doing that off and on. I especially enjoy sleep when I've had some dreams. And dreams aren't always pleasant. And by the way, dreams are very often bizarre. And I don't know why, but I've often thought, I said, maybe people with schizophrenia, these strange ideas about things, they see things that aren't there. And I'm just wondering if they're not in some kind of a dream state. And I've never read about it anywhere. But dreams are strange. People look different. You might be represented different. Things happen in a funny way. Animals show up. Maybe I'm just talking about my own dreams, but they get pretty strange. All right, there's going to be more on precautions in therapy. And I'd like you to, sign up here and join, make comments, and I'll try to answer questions in future. I guess this is a broadcast of sorts. That's enough for now. I'm tired, and talking off the top of my head as thoughts start rolling through about some of my own experiences in these matters. Thanks again for watching. The name's Don. Check it out. There's going to be several more on here. Look for my funny face and what I hope is decent or good advice. Bye.